There's a way of interacting with your clients, especially your most difficult clients, that can really rapidly, in my experience, dissolve stuck points in therapy. And it helps you and your client understand what's going on and how you can move forward. And the result is you make progress, you lose less clients, and you feel less burned out. So maybe you already have some solid ways of dealing with those challenges, but if you'd like to be more confident and more effective, I invite you to join my course on functional analytic psychotherapy, or FAP. So over 8 weeks, we're going to form a community of deliberate practice focused on improving how we engage with the clients who challenge us most. We'll talk about the realities of doing that work, and I'll teach you in a really practical way the theory of FAP, centered on how to compassionately and directly see how you're getting stuck. We'll also look at your unique vulnerabilities as a therapist. And we'll use real plays and some role plays to practice skills for engaging more effectively in those challenging moments. At the end of the course, you'll have concrete skills and confidence for building rapport with the clients who push your buttons, for creating a constructive conversation when you get stuck, and for finding a different way of interacting. You'll also have tons of handouts and tools for practicing those skills and embedding them in your practice. So FAP, Functional Analytic Psychotherapy, it's a science-based approach. It was developed at the University of Washington here in Seattle in the late 80s, early 90s by Robert Kohlenberg and Mavis Tsai, who were my mentors. And their work developing FAP, it was based on the same developments that fueled dialectical behavior therapy, acceptance and commitment therapy, and so on. So if you're comfortable with those treatments, you will find a home in FAP. And I think what you'll also find is kind of more clarity about how you address your therapy relationship issues. If you're not from a behavior therapy background, instead your work's more experiential or dynamic, what you'll find in FAP, I think, is a more precise way of formulating the interpersonal issues you encounter, and then compassionately and directly addressing them. So I know the name FAP, or Functional Analytic Psychotherapy, is not exactly approachable, yet what I see again and again over the last 10 years as I've consulted to clinicians on FAP is that the approach FAP teaches, it makes sense, it's natural, and it's effective. In fact, it's common for consultees who work with me to report not that the therapy's finished after they address the issues with their difficult clients using a FAP lens, but rather that they're again on the same page with their clients. And that happens amazingly quickly. It's often in one session, and it makes all the difference. So, if you want to practice skills for engaging directly and compassionately and constructively with your difficult clients so that you can move therapy forward, if you'd like to join a group of us doing and practicing that kind of work, then please sign up for my course and join us. I'd love to have you.